left-sided sensorineural hearing loss. With his permission, I am recording this video. And as we all know, sudden sensorineural hearing loss is an emergency situation where we have to evaluate the patient and start the treatment as earliest as possible. We did pure tone audiometry on first of all, complete ear examination was okay, except for the Rennie's test which I did with 512. It showed that left-sided sensorineural hearing loss is there. The Webers were obviously lateralized towards right side, indicating that left side he is having a lesser hearing loss. Our tympanometry was normal. Pure tone audiometry showed left-sided 80 decibel of loss on the left side. Along with the bone convection it was done. So finally I decided that immediately, as per the evidence-based practice and international protocol, an immediate intravenous dexamethasone was given, followed by prednisolone around tapering dose with 20 milligram 3 times daily. I started like that and slowly tapered down. On the third day, I saw a very slight improvement by doing a free field test of his hearing in my clinic, and then we decided to go ahead with the salvage treatment of intra tympanic steroid. Now, as we all know, a lot of treatment has been mentioned. As far as pictures and diagrams are concerned, I can produce it later onwards. Now, presently, I just wanted this video to highlight how I am managing these kind of patients with intra-tympanic injections. I do it in my clinic and it's absolutely safe. After completely explaining the procedure to the patient, I take complete approvals and consents. And after the consent is done, I usually prefer, in literature you will find dexamethasone in variant strength being used. The easily available strength is 8 milligram per ml, 4 milligram per ml. So we get a 2 ml ampule of 8 milligram. So in that I just use a complete ampule, and before that I see that I use xalocaine with adrenaline injection to do a local anesthesia, complete block of the post-oral infiltration I do. Then intra canal 4-quadrant injections I do with xalocaine and adrenaline. That gives a complete numbing sensation. Then I test it by my suction, by touching the eardrum, and there was a completely good achievement of anesthesia with this much of efforts. And then I use a metallic speculum, a Lambert's speculum, and then with this speculum I use for instilling the steroid. I use this one. Can you please focus on this? This is a spinal needle of 20 gauge, okay, 20 number needle of the spinal needle basically, and I shape it like this so that it doesn't come in my way of infiltration. I actually bend it like this so that when I do it, it goes directly into the canal, and also my hand doesn't come in the vision and the camera. So this is how I do it. I use, after the infiltration, I will show it. Can you focus here, Vishnu? I use the speculum with the split, the metallic speculum, and with the help of this speculum I can see the ear canal, and in the posterior quadrant what I do is, the best thing is to handle the instrument in a very delicate manner so that we don't touch any other area. So I see that the plunger is here, inside already. I can press it whenever I want. Okay, so the plunger is here touching my palm, and I'm holding the in such a way that it doesn't come in my vision. And this pin, this needle head goes, are you pointing here, Vishnu?
Yes.
So this needle goes inside the posterior quadrant now. I wish I could have shown it on the yeah, so here I go inside. I just pricked it. Any pain, Gilbert?
No.
No pain. So I am already inside the middle ear in the posterior quadrant, and now I am plunging it. Yes, yes. Any pain?
No.
No, don't move, please.
Okay.
Okay. So he has tolerated the whole procedure so well. I'm completely filling the middle ear. Now it started. I can see the level rising and now coming out of the drum. Yeah. Finish.